All right, hello everyone, and welcome to the Security Risk Assessment Tool Webinar. Today's presentation is hosted by the Office of the National Coordinator for Health Information Technology, the Office for Civil Rights, and Altarum. The Office of the National Coordinator for Health IT is at the forefront of the administration's health IT efforts and is a resource to the entire health system to support the adoption of health information technology and the promotion of nationwide health information exchange to improve healthcare. The Office for Civil Rights enforces federal civil rights laws, conscience and religious freedom laws, HIPAA privacy, security, and breach notification rules, and the Patient Safety Act and rule. Altarum is a nonprofit research and consulting organization that creates and implements solutions to advance health among vulnerable and publicly insured populations. Altarum is the contractor ONC selected to create the most recent version of the SRA tool. Leading our presentation today is Lisa Steffi, Project Manager with Altarum. For the purpose of today's presentation, we will reference the Security Risk Assessment tool as the SRA tool. Please note all attendees are muted by default, so if you have a question during the presentation, please use the question box in the GoToMeeting interface to ask it. We will address questions in part 2 of the presentation. Now I'll turn it over to Lisa.
Thank you, Ryan, for the introduction, and thank you everyone for joining us today. We've had overwhelming interest in these webinars, and so we're so excited everybody has taken time out of their very busy days to join us. We're thrilled that so many of you are interested in the SRA tool and want to learn more about it. So thank you for your interest and welcome. Our presentation today will be divided into 2 parts. The first portion will focus on an introduction to and an overview of the tool itself. We'll briefly talk about the challenges the healthcare industry faces when safeguarding protected health information, and we'll provide some background on why the SRA tool was created in the first place. We hope that after the first portion of the presentation, you will all walk away with an understanding of 4 main things: the SRA tool and its basics on how to use it, how to add the necessary information on your organization's assets and the vendors you do business with, how to complete a thorough security risk assessment, and finally, how to understand the results and reports provided by the tool. Throughout the presentation, we'll also cover some of the benefits for using this tool and how organizations can thoroughly assess and document the information security risks to EPHI in their organizations. Part 2 will serve more as an open forum where our panelists, including representatives from ONC and OCR, will address your questions and feedback. So let's get started. Let's first understand the challenge the healthcare industry regularly faces in regards to safeguarding EPHI. So we all know that as technology evolves and scammers develop new, increasingly sophisticated techniques to obtain our most private data, we all need to be exceptionally diligent in our assessments of our security posture. So small to medium-sized healthcare organizations are often the most vulnerable to hacking attempts due to limited time and resources. So the solution here was to update and create an SRA tool that was simple to use for small to medium-sized practices and provided a self-paced and thorough assessment while also saving them time by asking them only the relevant questions to their practice and environment, and best of all, free. ONC engaged Altarum to redesign and create an improved version of their existing SRA tool, which was originally created back in 2014. And Altarum, we started off by assessing where that tool needed improvement. So we conducted usability testing and gathered feedback from the current user community in order to identify key areas for improvement. We were able to take that feedback and turn it into new features within the SRA tool version 3.0, which is the version of the tool currently available. We built a workflow with a wizard-based branching logic, making it easier and less time-consuming for practices to evaluate their security risks. The SRA tool, though, is not a do-it-all tool, and merely using this tool and checking the boxes without truly assessing your risk would not be enough to document HIPAA compliance with the risk assessment requirement. But when properly used, the SRA tool can aid in the security assessment process. The SRA tool was designed to help covered entities and business associates that handle patient information to identify and assess risks and vulnerabilities to the confidentiality, integrity, and availability of protected health information in their environment. The HIPAA security rule requires healthcare providers, health plans, and business associates to conduct a risk analysis and implement technical, physical, and administrative safeguards to protect EPHI. Our goal in developing the revised version of the SRA tool was to assist providers and business associates with meeting their responsibility to protect EPHI. The tool guides users through an assessment based on the HIPAA security rule, and it is a self-paced questionnaire that includes a variety of reports for users to track their progress and assessment results. Question responses are grouped into areas of success and areas for review. Questions sorted into areas for success do not indicate compliance with the HIPAA security rule, but rather that your organization is aligned with the industry security standards and the recommended actions that help you protect and safeguard EPHI. Any known potential risks not addressed directly within the SRA tool should be documented by your practice or elsewhere within the tool. Now let's talk about the content within the tool. The SRA's assessment content was generated from these sources. We will soon be adding specific references to the NIST cybersecurity framework to each assessment question where relevant. Our team of security analysts compared these guides, cross-referencing each to create a content map to cover all essential areas, creating a robust content set of questions for the assessment section of the tool. One feature the tool offers is dynamic content. So as the security rule or NIST guidelines evolve over time, new questionnaire content can be downloaded and pulled into the SRA tool easily by users. Assessment content was broken down and grouped into 7 main sections, each with a series of questions and branching logic built within. Section 1 of the assessment covers security risk assessment basics. So essentially what your security management process is today. Section 2 covers security policies, procedures, and documentation. So how does your organization define your policies and procedures, and do you keep them on hand? Section 3 covers security and your workforce. So how do you define or manage access to systems, and how is your workforce trained on that security? Section 4 covers security and your data. So what are the technical security procedures you have in place? Section 5 covers security in your practice. So physical security procedures such as using key fobs, locked doors to access the physical building your organization operates out of. Section 6 covers security and your vendors. So all of the business associate agreements you have on hand and the vendors you do business with who may have access to your PHI. And Section 7 covers contingency planning. So what is your plan for backups and data recovery? Since the assessment contains branching logic, the subsequent questions within each section may be different depending on how you answer the current question you're on. So let's cover how to download and obtain the SRA tool. Users can download the tool from healthit.gov, and it can be installed on Windows machines running Windows 7, 8, and 10. Administrative rights are required for installing the tool, since it is a recommended security best practice that a security evaluation take place at the organizational level prior to installation of any new software. However, users do not need admin privileges to run the tool once it's been installed. The SRA tool runs from the local install directory and does not transmit any information to the Department of Health and Human Services, ONC, or OCR. Once the tool is installed, users can launch it directly from the icon on their desktop. Upon launching the SRA tool, users will need to first select whether they are beginning a new SRA or opening an existing one. To continue work already started on an SRA, to start a new SRA, users will first enter their name, select a location for their SRA file to save locally, and review the disclaimer information before beginning the assessment. If you select to continue an SRA, the system will prompt you to locate and select the SRA file you have already started from your local directory. The tool will then take you to the last place you left off. Please note though, if you have been using SRA 2.0, you won't be able to upload the results into SRA 3.0. The tool can support multiple user accounts and offers collaborative file sharing. So multiple people can have access to the tool and their own versions of the tool and still open or access SRA files that are in progress. If you attempt to enter a username that is already in use for a specific SRA file, the tool will alert you to select a new username. Usernames are used as an audit log for your SRA, so it's recommended to simply enter your first name and last name as your username. This will identify who within your organization completed specific sections or questions of the assessment. Again, all user-entered data is saved locally within the secure .sra file format and is only accessible for decryption by the SRA tool application. The SRA tool is set up similar to Windows Office programs in the way that it saves and opens files. So, for example, when you want to open a Word document, you navigate within your directory to find it and you open it. The SRA tool works very similar to this. So when you first launch the tool and select to continue an SRA, the tool will prompt you to select the file you want to open. It will then ask you to identify yourself by selecting your username. Again, this is for audit tracking purposes. To save an SRA in your preferred location, simply click on the area or icon where it says pick a spot to save your SRA file. This way, users can save progress as they go through the assessment by just clicking the Save button, and the SRA file will save to your preferred location. Once you have created a new SRA file, you then come to the home screen. The home screen gives users a brief description of what's to come and what to expect when filling out your assessment. The main navigation panel is located on the left side of the screen, but users can also navigate using the next and back buttons near the bottom of the home screen. The left navigation menu allows users to jump between certain areas of the tool, such as the practice info section, the assessment section, and summary section. But due to the branching logic within each assessment section, some navigation relies solely on the use of the next and back buttons at the bottom of the screen. The summary section becomes available once assessment sections 1 through 7 have been completed. We are currently working on options to change this and can discuss further on in part 2 of the webinar. Entering practice information. One of the first steps in the SRA process is documenting your practice information. So this is done in the practice info section. Practice info captures your basic contact information for whom the SRA is being completed for. There is also an option to document contact information for multiple locations if your practice or organization operates in different physical locations. Only one SRA needs to be completed across all of your organizations. The information captured here is included in your detailed report, which is a printable PDF version of your full assessment. Tracking practice assets. Tracking your organization's assets is a critical component to evaluating areas of risk. The SRA tool allows users to track their organization's assets in 2 ways. One, by uploading multiple assets at once by use of our template, or 2, by adding them individually. Users can track and see details on their assets at the individual asset level, including whether the asset has access to EPHI, the encryption level for that asset, the asset assignment, and even asset location. So depending on how you categorize and track your assets, that can all be monitored and managed within the SRA asset section. The table view at the bottom of the screen allows users to see at a glance their total assets by type, asset status, EPHI access, encryption level, and assignment. It allows users to select and move the columns into any order and sort the information according to their preference. There is also tracking as to whether you have disposed of the device. So if you want to track on whether it was disposed properly or the disposal date, you can track that as well. Management of your asset inventory is a vital piece of your security risk assessment, and the SRA tool provides an easy-to-use interface for uploading your asset list, overall asset management, and tracking your asset security. Here we're going to show a brief video of how to download the asset template for bulk upload of asset information into the tool. First, you'll navigate to the asset section and download the template. Save it locally and name the file. So in this instance, we're just saving to the desktop and naming it Asset Template. Once you've clicked and saved it, you can then open it and start to add your asset information manually within the template, following the columns as designated. Or if you have that information elsewhere in another Excel file, for example, you can do a copy and paste as long as the information is kept within the same columns and information that we've designated in the template. You can save it and then simply go back into the SRA tool and click to upload it. Navigate to where you saved the template with the completed information, keeping that CSV file format. And once you've clicked upload, it appears in the tool. You can then click to edit any of the information that you've just uploaded using the template. Make sure to keep the CSV file format though, because the SRA tool will not import from an Excel format. In addition, you'll want to make sure that the completed template is saved in a secure location on your network and password protected, since it is a comprehensive list of your assets. Or delete the file once you've uploaded it into the tool. Here we're going to show the specific fields the SRA tool prompts users to fill out when they're adding assets individually. The tool includes several areas of classification for asset types, including desktop, servers, tablets, and cell phones. We include EKG, EEG machines, and radiology and imaging machines. We even include EHR, EMR systems, and databases, network equipment, and media, backup tapes, thumb drives, etc. The tool does include a generic other for the asset type classification if the provided classifications do not cover the asset types your organization has. The HIPAA security rules risk analysis requires an accurate and thorough assessment of the potential risks and vulnerabilities to all of an organization's EPHI, including EPHI on all forms of electronic media. So it's extremely important to think about where your organization has assets across your entire organization and all forms of electronic media that may have access to EPHI. So for example, network devices such as routers, firewalls, infrastructure applications like virtual machines, all of the Internet of Things devices, they should all be securely protected and administrative rights and passwords on those devices updated regularly. It was our goal for this section to provide a simple method for tracking and managing all forms of electronic media that may have access to PHI. So moving on to tracking your vendors. So the asset tracking section of the tool and the vendors tracking section of the tool are very similar in terms of layout and functionality. Anyone your organization does business with can be tracked and evaluated within this section of the tool. You can opt to add them individually or download the vendor template as we showed with the asset section and fill in their information in bulk. The layout of this screen is extremely similar. You'll see at the bottom here, the table view has vendor name, vendor type, and then two columns to identify whether you've done a satisfactory assurances or assessed additional risks for that particular vendor. When entering your vendor and business associate information individually, the tool prompts users to complete the form shown here. Basic point of contact information is captured, but users can also indicate whether those satisfactory assurances have been obtained for each vendor or whether additional risks have been assessed. If users are unsure of what satisfactory assurances are, clicking on that blue underlined text provides the definition. There is also a comments box, which allows users to insert comments or notes specific to that business associate or vendor. It is important to remember that even when using the template for the vendor screen or the asset screen, it must be kept in that CSV format. The tool does not accept Excel files, so please be sure to keep those files in that CSV extension type. So here we're showing the practice documentation screen. The practice documentation screen allows and serves as a place to demonstrate accuracy and thoroughness of responses and other information as necessary to demonstrate accuracy and thoroughness of your SRA. So for example, this would be a location where you could add vulnerability scans, penetration test results, or maybe your mitigation plans. These are all documents that can be linked to your SRA to show and demonstrate accuracy and thoroughness of the SRA. Clicking the Add a Document link just basically links the supporting documentation to your assessment. And this section also collects and lists any documents that you linked to your assessment from some of the section summaries, which we can show you as we move on in the webinar. So here we're showing the assessment screen. So all assessment sections are set up in this screen layout with the section category and title at the top, the question in the middle there in the gray, and then your answer options just below in white, with education and reference information on the right side. As I mentioned before, the assessment section of the tool contains 7 sections. So these are all multiple choice questions, and it also contains self-rated threats and vulnerabilities areas after each assessment section. The education panel provides the guidance that's related to each response given, and that is dynamic, so as you make different selections on a given question, that guidance may change. And the reference panel links each question to the related HIPAA security rule citation, and it will soon show the NIST cybersecurity framework references as well. So the SRA tool provides users the resources to understand the context of each question by using plain language throughout the assessment questionnaire. It helps users consider the potential impacts to EPHI in your environment via our threats and vulnerabilities sections, which we'll show next, and also allows and helps users identify relevant security references via the education and references provided. After users have completed the questionnaire portion of each assessment section, there are threats and vulnerability selection and rating screens. These are shown here. Users are asked to select from a list of vulnerabilities that may be applicable to their practice or organization, and then rate the likelihood or impact should they occur. Important to note here is that any known vulnerabilities or potential threats not addressed by the SRA tool should be documented elsewhere or added to the section summary notes area. Thorough evaluation of the likelihood and impact of known risks should be documented as part of your SRA. For example, there are many times there are areas of risks that are present that we as everyday users don't always identify and assess, such as maybe a third-party app that would be installed on your facility manager's iPhone or Android. Each section summary ends with a section summary review. The section summary shows the questions that were presented, the selected responses by the user, and the education content relevant to that question. Again, questions are divided into areas of success and areas for review. Questions sorted into the areas of success are those which represent a thorough and/or accurate assessment was completed and aligns with the industry best practices. Questions that are sorted into areas for review represent responses that could use some improvement or need to be revisited in order to increase your security posture. So let's talk a little bit about conducting a thorough assessment. Conducting a thorough risk assessment requires users to evaluate potential risks and vulnerabilities. The HIPAA security rules risk analysis requirement specifies that organizations perform an accurate and thorough assessment of the potential risks and vulnerability to all of the EPHI the organization creates, receives, maintains, or transmits. So for example, when responding to questions regarding passwords and authentication, authentication should be considered throughout your organization. That is, it's not enough to only consider Microsoft Active Directory password requirements, but the organization should also consider how authentication is managed in other areas, including authenticating to a network and infrastructure tools and devices, or authenticating to computer and application administrative accounts, or remote access authentication, for example. The SRA tool may not address all risks relevant to your practice or organization, and if risks are known but not addressed within the tool, they can and should be documented outside the tool and linked to the tool using that add a document feature we showed earlier. Supporting documentation should be provided to prove a thorough risk assessment was conducted. This can also be linked to the tool using that section summary notes. Practices who have known risks, but those risks are unaccounted for within the SRA tool can utilize that comment section or note section I was just referencing. For example, an organization may decide that there is higher potential risk posed by remote access versus internal password or authentication controls. However, when responding to the passwords authentication questions during the assessment, they responded with respect to only the internal controls and not remote access. So in this instance, the organization should document the risks of remote access in the notes or comment section at the end of the relevant assessment section, and or attach supplemental documentation regarding its identification and assessment of those risks with respect to remote access in the add a document feature. The level of information put into the SRA will impact the final result, and the tool is only as good as the information you put into it. So let's talk a little bit about what you get from the tool once you've completed your assessment. Here we're showing the summary report. After all assessment sections are completed, the summary report becomes available. This is a cumulative high-level report showing your full assessment results. Important to note here is how your summary scores are calculated. Each section summary score is broken down in terms of risk percentage, not compliance percentage. The SRA tool does not calculate the assessment questionnaire in terms of compliance. The risk score is a calculated percentage of the number of questions that fell into that area for review, which is then divided by the total number of questions you were presented. This is due to the branching logic. This means that the tool is scoring the areas where your answer options were sorted into areas for review. The other two scores seen here are just a total of the number of questions that fell into the areas for review and the total number of vulnerabilities selected as applicable to your organization. You also see here at the bottom each section's risk score in terms of that risk percentage. One of the reports the SRA tool offers is a risk report. The risk report shows you where you have risk and what areas require review or improvement. Each vulnerability you selected as applicable to your organization is shown here, along with the combined risk rating for the selected likelihood and impact of the threats you rated. The risk breakdown is the sum of threat ratings in each risk category. The categories are low, medium, high, or critical, and are color-coded so users can see at a glance what categories have the highest score. The risk assessment rating key is in the upper right-hand corner of this report and shows how threats and vulnerabilities are ranked in terms of that likelihood and impact. At the bottom of the risk report, each vulnerability selected and threat rated is shown for your review, as well as the questions that fell into the areas for review category. The tool shows them by section and question and also shows your answer and education so you know how to improve your security in this area. Finally, we get to the detailed report. This is the last report and output from the SRA tool after your assessment is completed. The detailed report is a collection of all data collected within your assessment. And each question, response option, all selected vulnerabilities, and threat ratings are captured within this report, as well as all of the practice information, assets, and vendor information added at the beginning of your assessment. This report also serves as your audit log. So each user who contributed to the completion of the assessment will be shown within this report, along with a date and time stamp of when they answered each question. Please remember that this is only a tool to assist an organization with its review and documentation of its risk assessment, and therefore it is only as useful as the work that goes into performing and recording the risk assessment process. Once you have assessed your security risks using this tool, you may need to take appropriate steps to remediate any areas found wanting. Use of this tool does not mean that your organization is compliant with the HIPAA security rule or other federal, state, local laws and regulations. It does, however, help you comply with the HIPAA security rule requirement to conduct a periodic security risk assessment. The PDF button near the top of this report allows you to print it and keep this report elsewhere for your records. To continue to improve the SRA tool, we have several planned enhancements on our product roadmap. Please be on the lookout for these upcoming releases and new features. We're looking to add highlights to the threats and vulnerabilities rating and selection screens, as well as a mechanism to select multiple and delete all for the assets and vendors screens. We'll be adding the NIST cybersecurity framework references to each question. We'll also be looking to add an Excel export of the detailed reports and an in-process reporting functionality that allows users to flag questions to skip and review at a later point. Now we're moving on to part 2 of our webinar, which we'd like to address questions and feedback from the field. Please use the question box to answer your question in the ask your question in the GoToMeeting interface. While we wait for some incoming questions, there are a few example questions here from our SRA Help Desk that we'd like to address as they're frequent questions we receive from our users. So the first question here is, how do I revisit a specific question? So with this, once you've logged into your SRA file that's in progress, to revisit a specific question, you'll need to click into the assessment section and click the next button to get to the section where you were last left off in. And then you would click the back button to back up to the specific question you wanted to return to. You can at any time back up through the entire assessment and change answers, but please be mindful that as you do so, that may change your branching logic and take you down a different path or subset of questions. Question 2 here says, do I need to submit my completed assessment? No, assessments do not need to be submitted to any governing organization, but you should keep them on file for your own records to demonstrate accuracy and thoroughness of an assessment and that a periodic assessment was completed. Question 3 here, how often should I conduct a security risk assessment? So this one is a little broader. Requirements differ in terms of the timing and scope based on why the assessment is being performed. HIPAA has more of a broad scope and does not explicitly require a time frame. However, MACRA, or meaningful use, has a more narrow scope and states that a security risk assessment should be completed annually. Question 4 here is, do I need to start a new assessment each time I conduct an SRA? Again, this is a more tricky question to address because it really depends on the timing and scope of why you're performing an SRA. If you have had a change to your environment or a change in your organizational process, a new SRA should be conducted, but you can leverage some of the information such as asset tracking and vendor information from a prior year and keep that if no changes have been made to those assets or to the vendor information you have on file.